Zimbabwe's leader Robert Mugabe Desmond Kwandi. Getty Images. Team 2 hours Saturday, October 21, 2017. Zimbabwe President Robert Mugabe has been appointed a goodwill ambassador by the World Health Organization, sparking condemnation from human rights and health groups. The WHO's new chief Tedros Ghebreyesus is making the longtime African leader, 93, a goodwill ambassador to help tackle non-communicable diseases such as heart attacks and strokes across Africa. Dr. Tedros told a conference in Uruguay this week Mr. Mugabe could use the role to influence his peers in his region. These are non-infectious diseases such as cardiovascular diseases, cancers, chronic respiratory diseases such as chronic obstructive pulmonary disease and asthma and diabetes. Non-communicable diseases are the biggest killer globally, according to WHO. The organization estimates NCD result in 40 million deaths each year. In his speech, Dr. Tedros described Zimbabwe as a country that places universal health coverage and health promotion at the center of its policies to provide healthcare to all. Dr. Tedros, who is Ethiopian, is the first African to lead WHO. He replaces Dr. Margaret Chan, who stepped down in June. 24 organizations, including the World Heart Federation, Action Against Smoking and Cancer Research UK, released a statement criticizing the appointment, saying health officials were shocked and deeply concerned. The groups said they had raised their concerns with Mr. Tedros on the sidelines of the conference, to no avail. Embarrasses WHO. Human Rights Watch Program Director Ian Levine said Mr. Mugabe's appointment embarrasses WHO and Dr. Tedros. In 2008, the charity Physicians for Human Rights released a report documenting failures in Zimbabwe's health system, saying that Mr. Mugabe's policies had led to a man-made crisis. The government of Robert Mugabe presided over the dramatic reversal of its population's access to food, clean water, basic sanitation and healthcare, the group concluded. The Mugabe regime has used any means at its disposal, including politicizing the health sector, to maintain its hold on power. The report said Mr. Mugabe's policies led directly to the shuttering of hospitals and clinics, the closing of its medical school and the beatings of health workers. Additional reporting by the Associated Press in News http://cinews.co.uk